Men over 60, MD explains do these 5 simple daily habits for shrinking an enlarged prostate. There's a quiet question many men over 60 think about, but rarely ask out loud, even to their doctor. What is really happening to my prostate? Perhaps you've felt it. That frustrating need to get up to, maybe 3 times a night. Or that feeling that your stream just isn't what it used to be. It's a silent worry, an unwelcome reminder of the changes that time brings. Most men simply chalk this up to, well, just getting older. A problem without a solution. But what if I told you that one of the most significant factors influencing your prostate health is something we rarely discuss? And the science behind it is fascinating. This isn't just a guess. It's peer-reviewed science. A breakthrough study in the trusted European Urology journal followed tens of thousands of men for nearly 2 decades. The researchers uncovered an undeniable link between a man's frequency of ejaculation and a significantly lower risk for developing serious prostate issues. It brings to mind a patient of mine, let's call him Robert. He was a 68-year-old retired engineer, tired from sleepless nights and frankly, embarrassed by his situation. He felt lost. Robert's story is exactly why I'm making this video. I'm Dr. Audrey Wells. My promise to you is simple. Everything I share is backed by real science, not rumors. Today, I'll break down this discovery and give you a simple 4-pillar action plan to take back control of your prostate health. And please, stay with me, because I'll also reveal a secret weapon for your prostate that's likely already in your kitchen cabinet. Alright, let's dive into the core of our discussion today. The first and most talked about factor is the surprising connection between regular ejaculation and long-term prostate health. Now, here's a critical mistake I see many men make as they get older. They start to believe a myth, a dangerous myth. They believe that intimacy, or even self-pleasure, becomes less important, or that it's something to be reserved only for their younger years. Society sometimes whispers this idea that as a man ages, his vitality is supposed to fade into the background. But the latest science paints a very, very different picture. In fact, neglecting this natural part of your life could mean you're missing out on a powerful, protective health benefit. So why does this matter so much? What is the science here? Well, the leading theory is something called the prostate flushing hypothesis. It's a simple yet profound concept. Your prostate gland is constantly producing fluids. With each ejaculation, this entire system gets a complete flush out. This process actively clears away old cells, cellular debris, and potentially harmful substances, including carcinogens that might otherwise linger and build up inside the gland. If left to stagnate, these substances can trigger chronic, low-grade inflammation which, as we know, is a root cause of many serious health problems. And this isn't just a theory. As I mentioned earlier, the evidence is compelling. The landmark study published in the journal European Urology. It wasn't a small study. It followed over 31,000 men for nearly 20 years. The conclusion was crystal clear. Men who reported ejaculating 21 or more times per month showed a significantly lower risk of developing prostate cancer compared to men who only reported doing so 4 to 7 times per month. This provides powerful, large-scale evidence that this flushing mechanism plays a vital protective role. To put it simply, think of your prostate like the oil filter in your car's engine. Imagine what would happen if you just stopped changing the oil. Sludge, grime, and tiny metal fragments would build up. Over time, that buildup would clog the system and lead to catastrophic engine failure. Regular ejaculation acts like a scheduled oil change for your prostate. It's a natural maintenance routine, keeping the internal environment clean and functioning smoothly, preventing the dangerous buildup that can lead to problems down the road. So, how do we apply this knowledge practically and safely? This is the most important part, so please, listen closely. This is not the magic bullet. It is one single piece of a much larger health puzzle. You cannot maintain a poor diet, avoid exercise, and skip your doctor's appointments, thinking that this one habit will protect you from everything. It won't. This benefit is unlocked when it is part of a complete, healthy lifestyle. The goal isn't just about hitting a specific number. It's about understanding that your body has natural systems for staying healthy. And this is one of them. I remember the look on Robert's face when I explained this concept to him in my office. It was a look of relief. He told me he'd been carrying this quiet sense of guilt, a feeling that his body was somehow failing him. Understanding the science helped lift that weight. It helped him see that a natural, healthy part of life was actually a tool for his well-being. It reframed his entire perspective. If this idea of the prostate flushing mechanism makes sense to you, if it brings a little bit of clarity to this confusing topic, just do me a favor and type the word clarity in the comments below. It helps me know we're on the right track together. Now that we understand the importance of that natural flushing mechanism, let's get practical. Let's talk about what is actually happening inside your body as the years go by. And more importantly, what you can start doing about it today. There are 3 major changes the prostate goes through, particularly after age 50. And for each change, I'm going to give you a foundational pillar of action. A solid step you can take to build a stronger foundation for your health. The first major change is the most common one. It's enlargement. As I mentioned in the beginning, the prostate naturally tends to grow with age. In medical terms, we call this benign prostatic hyperplasia, or BPH. The key words there are benign. It isn't cancer, but it is what causes most of those frustrating urinary symptoms. So, to address this, your first pillar of action, and this is absolutely non-negotiable, is getting an annual medical checkup. But here's the biggest mistake I see, and I see it all the time in my practice: men wait. They wait until the symptoms become unbearable. They wait until they're getting up 5 times a night instead of 2. They put it off for another year, and then another. Many men do this out of fear or a sense of embarrassment. But waiting is the most dangerous gamble you can take with your health. So why is this annual checkup so critical? Because knowledge is power. Early detection is everything. Your doctor can perform 2 simple but vital tests. The first is a PSA blood test, which measures a specific protein in your blood. The second is the digital rectal exam, or DRE. These tests give us a clear snapshot of what's happening, allowing us to spot potential issues years before they become serious problems. We can track changes over time, and that data is priceless for making informed decisions about your health. And this isn't just my opinion. The science and medical consensus on this is overwhelming. The American Cancer Society states it unequivocally: early detection is the single most important factor in successfully treating prostate cancer. Finding it early often means more treatment options and better outcomes. It's that simple. To put it in perspective, think of this annual checkup like the routine maintenance on your car's tires. You don't wait until you have a blowout on the freeway at 70 miles per hour to check your tire pressure, do you? Of course not. You check it regularly. You check the tread. You do it to ensure a safe, long journey. Your body deserves, at the very least, the same level of preventative care. So how do you put this into practice? It's straightforward. Pick up the phone today and schedule an appointment with your primary care doctor or a urologist. Talk to them about your age, your family history, and ask them when you should begin annual prostate screenings. And about that exam everyone dreads, the DRE. Let's be men about this. It is a 15-second procedure that could literally save your life. Your health, your future is worth more than 15 seconds of discomfort. I had another patient, let's call him Frank. A wonderful man, but stubborn. He put off his screening for 5 years, always saying he felt fine. When he finally came in because the symptoms were disrupting his life, his condition was far more advanced and complicated to manage than it needed to be. His journey was harder because he waited. Please, don't be like Frank. Be proactive. Take control of the narrative. This is the first and most powerful pillar of your prostate health plan. All right, let's move to the second major change happening inside your body and our second pillar of action. This change is all about hormones. As men age, their testosterone levels naturally decline. But at the same time, the body converts some of that testosterone into a much more potent hormone called dihydrotestosterone, or DHT. High levels of DHT are a primary driver of prostate cell growth. It's like an accelerator pedal for prostate enlargement. So, to counter this hormonal shift, our second pillar is powerful. And it's something you have complete control over, starting with your very next meal. It is adopting an anti-inflammatory diet. Now, when I say the word diet, what do you picture? For most men, it's a list of boring, tasteless foods, complicated recipes, things you just don't have the time or energy to prepare. This is the biggest mistake. They think that eating healthy has to be a chore, a punishment even. But the reality is, the most powerful changes are often the simplest ones. It's not about deprivation, it's about smart substitution. So, why does this work? Why is an anti-inflammatory diet so critical for prostate support? It's because chronic inflammation is a key factor that worsens prostate issues. Think of foods like red meat, fried foods, processed snacks, and excess sugar. These foods create an inflammatory response throughout your body, including in the prostate gland. An anti-inflammatory diet rich in vegetables, fruits, and healthy fats does the exact opposite. It calms the system down at a cellular level. It provides the body with the tools it needs to fight back against the inflammation that rogue DHT hormone can cause. And the science on this is incredibly robust. Numerous studies have explored the link between diet and prostate health. Specifically, I want to talk about that secret weapon I promised you earlier. Many studies, including research published in prestigious journals like the Journal of Urology, have highlighted the protective power of a specific antioxidant called lycopene. This potent compound is a true powerhouse for the prostate. And the single best source of lycopene you can find in any grocery store is the humble tomato. To make this simple, think of chronic inflammation in your body like a small, smoldering fire in a forest. It's not a huge blaze yet, but it's constantly burning in the background, stressing the environment. Every time you eat sugary or processed foods, it's like pouring a little bit of gasoline onto those embers. It flares up. But when you eat anti-inflammatory foods like tomatoes, it's like a gentle rain. It cools things down. It helps to finally put out that smoldering fire. So, how do you put this pillar into action? How do you get more of this protective lycopene? It's very easy. Here is a fantastic pro tip you need to know. Your body actually absorbs lycopene better when the tomatoes are cooked. The heating process breaks down the cell walls, making the lycopene more bioavailable. This means things like tomato sauce, tomato paste, marinara sauce over pasta, or even a simple tomato soup are fantastic options. Even a little bit of ketchup, just be mindful of the sugar content, can be a good source. I advised my patient, Robert, to start incorporating this simple change. He loved pasta. So I told him, just make sure you have a good, hearty tomato-based sauce with your whole wheat pasta twice a week. It wasn't a punishment. It wasn't a difficult change. In fact, it was something he genuinely enjoyed. It's a perfect example of synergy. You take a food you already like and you learn how to use it to its maximum health benefit. It was a small tweak, but making those smart, simple choices consistently made all the difference in how he felt. We now arrive at the third major change your body undergoes. And this one is simply a matter of statistics. It's the increased risk of cellular abnormalities. Think about it. Your body is a miracle of regeneration. Every single day, it replaces billions of old cells with new ones. Over the course of 60, 70, or 80 years, that's an astronomical number of cell divisions. With each division, there is a tiny statistical chance of an error occurring. Over time, those chances add up. This is why our third and fourth pillars are so crucial. They are your daily defense team. Pillar number 3 is consistent physical activity, and pillar number 4 is proper hydration. But let's address the big mistake right away. When men hear physical activity, they immediately picture a 20-year-old at the gym, lifting heavy weights and running for miles. They think, that's not me. My knees ache. My back isn't what it used to be. I can't do that. And so, they do nothing. The other common mistake is underestimating the power of the simplest thing of all, drinking enough water. They see it as trivial. Both of these mistakes are holding you back from profound health benefits. So, why are these two pillars so effective as a team? Let's start with movement. Consistent physical activity is one of the best things you can do to support healthy hormone balance. It improves circulation, which means more oxygen and vital nutrients are delivered to every cell in your body, including your prostate. It also helps manage weight, which reduces overall inflammation. Proper hydration, meanwhile, is essential for kidney and bladder function. It keeps your urine diluted, which reduces irritation, and it helps your entire urinary system run smoothly, continuously flushing out toxins and waste products. And the science here is undeniable. The Prostate Cancer Foundation explicitly recommends regular exercise. As a core part of a risk reduction strategy for men, it's not a fringe idea. It's mainstream medical advice. Furthermore, specific studies have shown the remarkable effectiveness of a particular type of exercise you can do anywhere, anytime. I'm talking about Kegel exercises. Research has demonstrated that strengthening these pelvic floor muscles can lead to significant improvements in urinary control and support for the bladder and prostate. Here's the analogy I want you to remember. Think of your body's circulatory and urinary systems as a network of rivers and streams. Consistent movement, like a brisk walk, is what keeps the river current flowing strong. It prevents the water from becoming stagnant and murky. And proper hydration, that's the water itself. Without enough water, the riverbed dries up and nothing can flow at all. You need both a strong current and plenty of water for the ecosystem to thrive. So, how do you put these final two pillars into practice? It is simpler than you think. For physical activity, I'm not asking you to become a marathon runner. I'm asking you to aim for a 30-minute brisk walk on most days of the week. Find a route you enjoy. Listen to a podcast or some music. Just move your body. Strength training a couple of times a week is also fantastic for hormone regulation. And for those Kegel exercises, you can do them while sitting in a chair watching the news. Simply tighten the muscles you would use to stop urination, hold for 3 seconds and release. Aim for a set of 10, 3 times a day. For hydration, the goal is simple. Keep a water bottle with you throughout the day. Your target should be around 64 ounces, which is about 2 liters. Don't try to drink it all at once. Just sip consistently from morning until evening. My patient Robert embraced this combination. He started a morning walk routine. just around his neighborhood. And he made a point to finish one large water bottle by lunch and another by dinner. He told me that within a few weeks, he not only felt more energetic, but his nighttime trips to the bathroom had noticeably decreased. It was a true win-win. A powerful synergy between two simple daily habits that gave him back his energy and his sleep. So, to bring everything together, we've covered a lot of important ground today. We learned about the surprising science that suggests regular ejaculation may be beneficial. And more importantly, we established the 4 essential pillars for building a truly resilient prostate: getting your annual checkup, adopting an anti-inflammatory diet, staying consistent with physical activity, and making sure you are properly hydrated. But as I always say, knowledge without action is just entertainment. I want you to leave this video with a clear plan, so here is my simple 3-step prescription for you for this week. First, schedule it. Before this week is over, pick up the phone and call your doctor's office. Get that annual checkup on the calendar. Second, add the red. Intentionally add cooked tomatoes to at least 2 of your meals this week. Think pasta sauce, soup, or chili. Third, take a lap. Go for a brisk 20-minute walk on 3 different days this week. That's all, just 3 short walks. Now, I know what you might be thinking. You're busy, you're tired. Is a 20-minute walk or a bit of tomato sauce really going to make a difference? And my answer to you is absolutely yes. Lasting, meaningful change in your health doesn't happen with one giant leap. It happens with one small, smart step repeated consistently over time. Think about it. 20 minutes is just over 1% of your day. Isn't your strength, your independence, and your quality of life worth 1% of your day? Because this journey is about so much more than just avoiding annoying symptoms. It's about having the energy to get on the floor and play with your grandkids. It's about having the confidence and freedom to travel, to pursue your hobbies, to live your life on your own terms, without being a burden to the people you love. That is what's truly at stake. So, if you are ready to take responsibility for your health journey, I invite you to join our community. Please, do me a favor and hit that subscribe button so you don't miss our next science-backed guide. And to make a real commitment to yourself, go to the comments section right now and type 2 simple words: Day 1. Let this be the day you start. Let's support each other in the comments below. Thank you for investing this time in yourself. In our next video, we're going to discuss 3 specific supplements that have been scientifically shown to support joint health. You won't want to miss it. Until then, remember this: your health is your greatest asset. Take care of it.